Good afternoon, dear patients. Today we will discuss a clinical case presented in the picture. A young man came to us complaining of pain in the area of a lesion on his head, as well as pus discharge from this lesion. Initially, he developed swelling in the scalp area. After reading information on the internet, he decided that it was an abscess. He started taking amoxiclav orally on his own, without any tests. Despite this, the lesion continued to grow, became more painful, and the lymph nodes, both the postauricular and posterior cervical nodes, also became swollen. He ignored it, continued not only taking amoxiclav but also applying fucorsine to the lesion. He didn't pay attention to its effect. It kept getting bigger and more painful, and eventually he realized that it was time to stop reading the internet, stop applying all sorts of nonsense, and that he really needed to see a doctor. At the time of his visit, an infiltrate was found on the skin of the scalp, which you can see in the picture. There were several openings in it, from which pus was being discharged, specifically thick pus mixed with blood. And inside this infiltrate, upon close examination, you could see necrotic masses of a greenish color, which were gradually starting to separate along with the pus. And naturally, the lymph nodes were also enlarged. What should be done in this case? First of all, it is necessary, of course, to perform cultures, bacterial cultures, which was done, of the discharge, in order to determine its sensitivity to antibiotics. Secondly, to identify the specific bacterium itself. Secondly, it is necessary to perform cultures for fungi. If we talk about what this purulent infiltrate, which in fact is initially a carbuncle, needs to be differentiated from, it should be differentiated from infiltrative suppurative trichophytosis. This is a fungus that is transmitted directly from animals to humans. You can find more detailed information in separate videos on our channel about fungal infections of the scalp, particularly about infiltrative suppurative trichophytosis. So the most important thing is to rule out this particular fungus. That's the first thing. Secondly, it is necessary to rule out immunodeficiency. Carbuncles rarely form just on their own. Considering that there is currently a surge in HIV infections, it is also necessary to rule that out. Thirdly, it is necessary to do an immunogram to assess the state of the immune system, to find out why, all of a sudden, a young man who is not a drug addict, has no obvious external irritants, is not a substance abuser, and is not a drunkard, suddenly developed a carbuncle. In other words, to put it bluntly, the skin on his head started to rot. We need to look for some reasons behind what is happening, because the cause of the carbuncle, as our culture test showed, is just ordinary Staphylococcus. There is nothing supernatural about it, no magical bacteria involved. As a result of the tests, it was determined that, first of all, the fungus test was negative. Well, generally speaking, from the patient's history, it was also known that he had not been in contact with any animals at all over the past few months, so this immediately reduced the likelihood that it was infiltrative suppurative trichophytosis. Accordingly, the diagnosis of carbuncle was made. With such a diagnosis, at the beginning of treatment, you shouldn't just take some pills. More precisely, you can take them too, but at the beginning of treatment, it is advisable to prescribe injectable antibiotics. In our case, injectable antibiotics were initially prescribed. Rocephin was administered intramuscularly, the enzyme chymotrypsin was also given intramuscularly, and accordingly, Panavir was administered intravenously after the immunogram was taken. After the sensitivity of the Staphylococcus to antibiotics was determined, the antibiotic was gradually switched to an oral form, but this happened only after a week when clear improvement began. It was specifically replaced with levofloxacin or Tavanec in tablet form taken orally. But I want to mention again that in such cases of acute inflammatory changes, it is advisable to start with injectable antibiotics. Topical therapy is very important. First of all, it is necessary to disinfect the skin around the periphery, for example, with salicylic alcohol. At the suppuration stage, ultraviolet light or dry heat is needed, which was prescribed for this patient. In general, as I mentioned, immunomodulatory drugs were also prescribed, taking into account that the HIV test was negative. He was then consulted by an immunologist regarding immune correction based on the results of his immunogram. in order to prevent the formation of similar carbuncles in the future. The resolution of the carbuncle occurred in about 2 weeks. A superficial scar formed which gradually, of course, lost its hair. Why? Because scar tissue essentially pushes out the hair follicles, and a person ends up with this kind of localized bald spot in their hair. Unfortunately, aside from cosmetic hair transplantation, it can't be eliminated any other way. But the young man wasn't too bothered by it, since it was relatively small in size. The takeaway from this case is that if you develop a painful growth and there is no clear improvement from your self-treatment within 1 or 2 days, of course, it's better not to self-treat at all. You should see a doctor as soon as possible, rather than waiting until you already have a large swelling, edema, and enlarged lymph nodes. Naturally, you should immediately get the tests done, as I described above.